Hey guys, what's up? This is Stephanie. Welcome back to my channel. So in the video today, I'm going to be discussing what are some common questions, or also known as your PIMP questions. Once again, I did not come up with that verbiage. That's just something that is used for students. I made previous videos where I was discussing that I was getting pimped by a doctor, and I got very hateful comments. So just pimping is just what questions do doctors ask you or your preceptors ask you during your rotation. So I actually wanted to address this in a video, and let's just hope I don't get any hate in this video below. But pimping is just going to be a term that you use. Some of the terms that I would use when I was talking to other medical students or residents is just what questions will the doctor ask you, just to see what type of knowledge you have. And then of course they ask you questions because it not only helps you, it helps you as a student, right? It helps you learn things that you don't know. And of course, like I said, they want to know what you know. And so expect definitely to be asked questions throughout your rotations. I think by far the ones out of all my rotations, the ones where I got asked a lot of questions was definitely during my ER rotation by far, and then also my burn rotation. So just make sure that you prepare yourself for these. If you don't know the answer, just frankly say you don't know the answer. I don't know the answer, but I can go home, and once I get home, I'm going to look up the answer. And that's what I would do, especially if it was a question I didn't know. I would tell them I don't know the answer. I would write it down. So I made sure I brought a book with myself, because in that book, I made sure that I wrote down information about the patient I would see. Of course, not any HIPAA violations or anything like that, but just information in regular, because I would like to review this once I got home, and then just go over the patients I had seen, like what diagnostic treatment the doctor gave that patient, what diagnostic tests did we do for these patients. And so that's why I kept my book. That way it would help me learn. And then on top of that, certain rotations in certain programs, if not all, the majority of the programs here in the US, you are required to input a certain amount of patients, like log them on. And this helps you as a future PA once you graduate, because you're gonna have to be very good with inputting medical records, right? Inputting information in patients' medical records. And that's kind of like prepping you for that. And so you're required to put the patients that you see throughout the day. And that's why I would also write the information down on my book. And this is where I would write, if the doctor had asked me any question that I did not know the answer, I would tell him, I'm gonna look it up. I would go home, research it. I love osmosis. I'm a visual person, so I would research an osmosis or even up to date. Especially if it was a question on pathophysiology, which is one of the common ones that I really got asked on, was the pathophysiology of certain diseases. For example, I got asked about the lactic acid pathway, and the doctor wanted to know everything about the lactic acid pathway, because I wanted to order a lactate on a patient that was coming in with a heart attack, a myocardial infarction. And so he told me, before you order this, what is the pathway of the lactic acid pathway? And I had no idea. And so that day I went home, I watched a osmosis video, and I made sure I learned everything and knew everything about the lactic acid pathway. I even wrote notes, so then the following day I could explain it to him. And so then the next day I would go up to him and, Dr. So-and-so, you had asked me about the lactic acid pathway. I would like to share with you what I found, so etc. Another thing that I would get asked on would be treatments, so certain medications, especially during my pediatrics rotation, for example. I got asked a lot in regards to the mechanism of action of certain antibiotics. Like, my doctor during that rotation was very particular in regards to antibiotics, knowing the mechanism of action of antibiotics, what antibiotics are useful against this type of bacteria, gram-negative, gram-positive, aerobic bacteria, anaerobic bacteria, etc. So during that rotation, I got asked a lot in regards to antibiotics. So I have to thank that doctor, because my knowledge of antibiotics before that rotation was not very good. After that rotation, I forced myself to learn the antibiotics well, and to learn the common bacteria that are treated by these antibiotics. But I have to thank him to this day. My knowledge is very good on antibiotics because of him. So that was another thing that I got asked on a lot, was just mechanism of action of certain medications. Now, during like my burn rotation, during that rotation, I got asked a lot about pathophysiology. So I got asked a lot in regards to pathophysiology of certain diseases. And that makes sense because just in critical care medicine, and that's one of the reasons why I decided to do critical care medicine, is that you just have to have an understanding of the physiology of the body and the pathophysiology of the disease. And in order for you to treat that patient well and to ensure that you're giving the patient the appropriate amount of fluids, the appropriate medication, you really need to understand that pathophysiology of the disease. What is it doing? And so during that rotation, especially during rounds, in critical care medicine, with rounds, usually what we do is that we discuss every patient in a round. And during that round, you have different medical professionals. So you'll have the PA, the doctor, the surgeon, and/or surgeon. In this case, it was like a burn surgeon. You'll have your physical therapist, or so rehab, occupational therapist. You'll also have the nurse that is taking care of that patient, the charge nurse. And then you would also have a psychiatrist, since a lot of our patients that we were seeing also had a lot of like psychiatric problems, especially if they were involved in a huge burn, right? A lot of them had like acute stress disorder, anxiety. So we'd also have the psychiatrist with us, and then we would also have the social work with us also, and even a nutritionist. And so during those rounds, especially when you're presenting the patient like I was, sometimes I would get stopped and asked in regards to the pathophysiology of the disease, and it was really nerve-wracking. Especially if you don't know the pathophysiology, which I have to be honest with you, it happened to me a lot because I was not only nervous about the situation, which made it even more nerve-wracking, I just couldn't think. I didn't have a very good understanding of certain pathophysiologies. So during that rotation, I really went home and ensured that I knew my pathophysiology well. I knew my physiology well, especially like the skin physiology, right? Because we do a lot of burns. Third spacing, why do we give fluids in patients that have shocks, the different types of shocks, right? So these are some of the questions that you would expect to kind of see in some of your rotations, right? Like I said, and it really depends on the rotation. Psychiatry definitely got a lot of asks on your medications because, you know, depending on how the patient's presenting is what medication you're going to give. Also, I got a lot asked on physical exam findings. What were the physical exam findings that this patient was presenting with and what medication was causing it? Like the patients that were having, for example, your Parkinsonism side effects, right, of your first generation antipsychotics. So I would be asked questions like that. And so just expect to be asked questions. If you don't know the answers, be honest and tell the doctor or the individual who is precepting you, whether it's a PA or a nurse practitioner, that you don't know the answer, but you will go home and look it up. And that's what I did the majority of cases. If it was a disease I had never heard of, when I was rotating and we saw patients, like for example, I saw a patient once with Ehlers-Danlos syndrome, and I had briefly read about that disorder, but didn't know about it in depth. So I made sure I wrote that disorder down. I went home and I learned as much as I could about Ehlers-Danlos syndrome. And so that's an example. So if there's something that you've never seen before, make sure you go home and you learn about it. And so yeah, hopefully this video was helpful for you guys. Just what I want to say is expect to be asked questions. They don't do it, the doctors and the PAs that you're with, they don't do it, even nurses, I got asked by nurses, they don't do it to be mean, right? They really want to see what you know, and it's a way that they can teach you also. And if you don't know, just tell them you don't know, right? And make sure you go home, study that, and the next day show up and you're like, hey, we had discussed this yesterday, and this is what I found, or this is what I learned, can I share it with you? So just expect to be asked a question in regards to medications, physiology, pathophysiology, and then I even got asked on the mechanism of action of gram-negative bacteria and in the tissue, the type of tissue that's found in the vagina. So those are some of the questions that I got asked also. So you'll be asked a lot of questions. So just prepare yourself. I know it's nerve-wracking, especially like the first day I would get really, really nerve-wracking, especially if I didn't know the answer. And during rounds, like you're in front of 6 other people and they're all waiting for you to answer. And if you don't know the answer, it's even more nerve-wracking. And if you're with a classmate that's with you rounding, like help them. That's another thing I have to say. Like when I was rotating with one of my classmates, we helped each other back and forth whenever we would get asked questions during rounds. And so, because sometimes you're put in the spot and you can't think. And I know, for example, when he would be put on the spot, he's like, but I knew the answer because I was not put on the spot, so I was able to help him. But I know if I was put in the spot, I would not know the answer. So if you can, help your classmates. And then most of the doctor would be like, yeah, you're right. And then your classmate would be like, thank you. So help your classmates. All right, guys, as always, I hope you guys like this video. And if you guys have any comments or any suggestions for other new videos, comment below. And I will talk to you guys later. Bye.